Welcome to the latest edition of Neuroscience Updates, covering breakthroughs in the past 2 weeks. Brought to you by LucidQuest. Teva agreed to acquire Emalex Biosciences, adding ecopipam to its neuroscience pipeline. Ecopipam is an investigational selective dopamine D1 receptor antagonist being developed for pediatric Tourette syndrome. The deal includes $700 million upfront, up to $200 million in commercial milestones, and royalties. Getty and Richter reported results from a 6-week exploratory Phase 2 trial of ABBV-932, also known as RGH-932, in 161 patients with bipolar depression. The overall drug-placebo difference on MADRS was not statistically significant, but a pre-specified bipolar 1 subgroup showed an efficacy signal. Eli Lilly Canada received Health Canada approval for Kisunla, or donanemab, for early Alzheimer's disease. Kisunla is a once-monthly intravenous anti-amyloid therapy for mild cognitive impairment or mild dementia due to Alzheimer's disease, making it the second Alzheimer's disease-modifying drug approved in Canada. Axsome Therapeutics received FDA approval for Auvelity, a combination of dextromethorphan hydrobromic acid and bupropion hydrochloric acid for agitation associated with dementia due to Alzheimer's disease. Approval was supported by Advance 1 and Accord 2. Teva Handok received South Korea MFDS approval for Ajovy, or fremanezumab, for episodic migraine prevention in patients aged 6 to 17 years who weigh at least 45 kilograms. Ajovy is an anti-CGRP monoclonal antibody previously used for adult migraine prevention. Eisai and Biogen reported that FDA extended review of Leqembi Iqlik, or lecanemab RRMS, as a once-weekly subcutaneous starting dose for early Alzheimer's disease. The review was extended by 3 months after additional information was deemed a major amendment, with a new PDUFA date of 24 August 2026. Roche received CE mark for Elecsys p-tau217, a blood test developed with Eli Lilly that measures phosphorylated tau217. The single-assay blood test is intended to help rule in and rule out Alzheimer's pathology in symptomatic patients with cognitive decline. Genentech received FDA approval for intravenous Ocrevus, or ocrelizumab, for pediatric relapsing-remitting multiple sclerosis in patients aged 10 years and older who weigh at least 25 kilograms. Ocrevus is an anti-CD20 monoclonal antibody studied in the Phase 3 Operetta 2 trial. Stay ahead in neuroscience research. Like, share, and subscribe for our updates. Visit www.lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.